really, I appreciate all of you being here. I think this has been a great discussion on recent advances in treatment of pancreas cancer and where the future lies for the treatment and their patient care. And before we end this program, I just want to get final thoughts from each of our panelists. One thought per person. And I'm going to start with, I'm going to be nice to Tom. You hit it.
So I think that this was a great discussion, and it really does show how much is coming down the pike, and I think we have reason to be optimistic, and that's more than we can say for that's better than we can say yesterday, and hopefully tomorrow there's going to even be more to be optimistic about.
Love it. Caio.
I just want to emphasize the value of clinical trials. We still, the participation in clinical trials in this country is still single digit. So I hope that with the progress we've made and with the excitement going on with the new drugs, vaccines, and the activation of the immune system, targeting the stroma with, minimizing targeting hyaluronic acid, among others, will make the community of oncologists to pay more attention to clinical research.
I love it. Philip.
Treating the whole patient.
Yes.
Numbers and clinical trials, scans, but treating the whole patient, supporting them with an urgent fashion when they first present, and continuing to do that. Not think of starting someone on a chemotherapy before you think of how shall I make this patient feel more comfortable. You can't change the diagnosis, but you can change their mental state, their comfort level, and same for their caregivers. So that's very important. And then continue doing that while they're getting chemotherapy, with the idea of, on the one hand, giving them the treatment, not doing less, but at the same time maintaining their quality of life and dignity, because by doing that, you can also almost ensure that they will continue as long as their disease allows them to continue in terms of the biology, rather than stopping it at an earlier point. So back to a judge, who's an important person, I'm sure, in the community, you give them FOLFIRINOX, and after 3-4 cycles, they crash, which they may, after a Whipple, they may stop the treatment. I'd rather give them 6 months of clean gemcitabine than break the chance.
Oh, and George, now you get the final word.
Well, they didn't crash. They did very well. They went for actually a checkpoint inhibitor trial, and he's doing very well. So that's all good news. But I echo actually what you just said, in that you've got to keep the patient going. And we don't recognize how heroic these individuals are. They come in, chemo is still in many ways controlled poisoning. They go home, they're sick. Their families are driving them, they're managing the diarrhea at night, the inability to sleep, the pain. I mean, they are very heroic, and I think we just have to continue to help them along the way. And that's why nurse practitioners, our mid-levels, are so important.
Absolutely.
And then we've got to get away from this negativity,
Exactly.
right? We're still negative, the gastroenterologists, the surgeons, the radiation, the medical oncologists. We collectively have got to get away from the negativity, and we've got to keep moving forward. And we're going to see some advances, and there's some exciting treatments out there. Some of these treatments don't even involve chemotherapy. They're monotherapy. They don't have the typical side effects. So I think we have to be optimistic. Even George Kim is optimistic.
I have to say that you're the most positive I've seen you. I haven't seen you as positive as this before.
I love it. Fantastic. On behalf of our panel, we thank you for joining us.